Good morning and welcome to Health Talk, sponsored by Mon General Hospital. This program is designed to provide education on vital health topics to help you take charge of your health. You'll also be introduced to Mon General's committed physicians, allied healthcare professionals, and quality programs and services. And now, here are your Health Talk hosts, Kay Murray and Jim Stallings.
Good morning and welcome to Health Talk, brought to you by Mon General Hospital. I'm Jim Stallings along with Kay Murray, and with us in the studio this morning is a man who most of us in the community are familiar with for many different reasons, but most of all, he's many of our eye doctors. He's just one eye doctor, but for many of us, he's our eye doctor. Dr. V.K. Raju is in the studio this morning, and if you wouldn't mind sitting up closer to the microphone, sir, good morning.
Good morning, sir.
Welcome to the program. Today, we are focusing on eye problems and diabetes. So tell us what the relationship is between diabetes and eye problems.
Yeah, in diabetes, if it is not treated well, or the patient doesn't take the responsibility, it leads to lack of oxygen in the eye, leaky blood vessels, and slowly it takes away your vision.
So these are people who don't keep their glucose levels under control that can develop these problems?
Glucose levels, blood pressure, and cholesterol, all three are important.
Okay, so the number of people that have type 2 onset diabetes is alarming, I'm sure, to you.
Yes, sir.
And so the goal of keeping that sugar down, usually it's 120 or under. Maybe now it might be 110, right?
Yeah, that keeps on changing a little bit, but around that, still, not the number may not be the most important thing. A combination of things, and each individual patient may be a little different. Some people may, even 120 may be okay, some people it isn't.
Does it start showing up when you have blurred vision? I mean, you've been diagnosed with type 2 diabetes, you're on medication, but your vision starts getting blurry?
It takes almost 6 to 7 years, 8 years before it starts in the eye. So, simply because you have diabetes and you don't have any blurry vision, that doesn't mean it's okay, you can do whatever you want to. So it takes 7 to 8 years before it comes into the eye. But before it comes into the eye by regular examinations, incredible what we can do compared to 30 years ago. Less than 10% of diabetics will have major problems if we all do it right. All means the doctor as well as the patient.
When we go to visit our ophthalmologist and we have diabetes, they always seem to perform a pressure test. Could you explain what that diagnosis is?
Yeah, that's another very important thing is glaucoma. And if the pressure is caught early, treated early, glaucoma may be less serious than an automobile today. Because the advances are so much, but again, the same thing, catching them early.
Okay, so what is high pressure doing to our eyes?
Yeah, the eye pressure is also interfering with the blood supply of the optic nerve. When we go and get enough blood supply, we don't get enough oxygen, and then the cells go bad. And that's a very slow process. Diabetes as well as glaucoma, these are all slow process. If we catch them early, incredible things can be done. In the last 30 years, extraordinary advancements happened. But still, for anything, the three best doctors are Dr. Diet, Dr. Exercise, and Dr. Merryman. That means starting the day with the good morning God rather than good God morning. Still, those won't change.
Blurry, what other signs would we have if we know that our eyes are being affected by diabetes?
Early changes, people can have that blurry vision, as he said, could be for reading, could be while driving. So it is still slight blurring of vision. Sometimes that may be intermittent. Today you had a little blurred vision, by tomorrow it is gone. It can happen. Any disease we have, an oncoming disease, can be intermittent symptoms, so you should not ignore.
And if you do ignore for a long term, it can lead to blindness.
Exactly. But as I said again, diabetes today, if patients take the responsibility and doctor to take early good care, less than 10% will be blind.
In fact, in reading some of the information, if we do the right things and keep our numbers at the right levels and diet and exercise, keep our cholesterol low, we can reverse this. Is that correct?
Absolutely. In a way, I mean, I don't know whether it's total reversal, but when you keep it under control, as I said, I mean, the last 10, 15 years, we have learned incredible things. Almost 1 in 4 diabetics, after 35 and 40, this is adult onset. We are not talking about children. If we take care of ourselves with, as you said, diet and exercise, they may not need medication.
Back in the mid-'90s, when I first discovered that I had high blood sugar, I always was curious of why you would talk to me about my weight and about my diet. I mean, I thought, well, this guy's an eye doctor. Why is he so concerned about my weight and my diet? And now I know why, because diabetes affects our eyesight so much. Now, I also asked you, could I have LASIK surgery to correct my eyesight instead of wearing glasses? And you had a concern about a diabetic who has LASIK surgery. Why is that?
Yeah. Of course, some diabetics, still you can do LASIK surgery. By and large, when you do LASIK, the healing in small number of people could have healing problems, and the diabetics, can have healing problems, especially if the blood sugar and other things are not good. And unless you are... here is a sportsman, which glasses will be a terrible thing for you. Sometimes we get involved too many things, and if it is may not be safe, it is always try to avoid those things.
Right. So we're going to talk about cataracts in just a moment, but I just wanted to revisit glaucoma for just a second. Now, glaucoma is the restriction of blood entering the optic nerve.
Yeah. The combination, it's not as simple as that, but combination of things can happen, but most important, as you said, the blood supply to the optic nerve is not good, and the pressure may be causing that to some extent.
You do a great job of explaining that to patients. From what I remember, you're saying the fluid going into the eyeball and coming out of the eyeball was not equal.
Exactly.
So that increased pressure in the eyeball because the fluid's not getting out through those vessels, correct?
Exactly.
See, I remember a little
bit.
bit.
He's listening to you, Dr. Raju.
Thank
He's
you.
listening.
Well, if everybody listens.
But the
and
test...
If we all listen to our mothers,
But the test I remember taking, I guess it was the eye pressure test, where you got to identify the little dots in your field of vision. Is that the pressure test?
No, that's not the pressure test. Pressure test is with the tonometer. We put a couple of drops and gentle pressure on the eye with the tonometer. We can measure the pressure by an instrument. The dot test is the glaucoma doing any damage to the eye? And if the dot test is all good, that means there's no damage, and you can keep that way by medication, laser, or real surgery. As I said, last 30, 35 years, the advances we have are incredible, but yet our lifestyles got worse.
I was going to say, let's talk a little bit about West Virginia and lifestyles, and I'm sure during your time and your practice, you have seen an upswing in how people are taking care of themselves. We know West Virginia really has bad numbers, and they don't seem to be getting any better. In fact, there was a study done where the sweetest place on earth is, and that is?
Logan County in West Virginia.
Yes, and what come from the study that declared that Logan County had high numbers?
Yeah, I traveled quite a bit, and I found that book about 4 or 5 years ago. a New Yorker, he lives in New Jersey. The New York reporter is a correspondent of the New York Times. He himself is a diabetic, is a juvenile diabetic, one of the first insulin pumps he had. We all should understand the juvenile diabetics in children is different from adult diabetics. That is mostly genes and they'll need insulin. But the adults is, genes may be there too, but by and large, our lifestyle is very, very important. In Logan County, he put a chapter there about 5-6 pages, and what is written in that book, as much as we love our West Virginia and we're West Virginians, that's not anything complimentary.
The number was like 14.8%.
Yeah, almost 15-16% of people in Logan County over 21 have diabetes.
And that is relatable to lifestyle, poor nutrition, something about where they're located and living?
Yeah, combination of things again, but the obesity in Logan County is unbelievable. There are 37 fast food restaurants and places like that in a county of 37,000 people. The Logan County Walmart sells more snack cakes than any Walmart in the world. Again, let's not keep on blaming one group or the other. It's not the fast food restaurants you don't keep on blaming, but they are responsible, we are responsible.
That's right.
304-296-0041 is our telephone number. Dr. V.K. Raju, founder and medical director of the Eye Foundation of America. And if you have any questions, you can call us at 304-296-0041.
The doctors, the latest news and procedures. Your local health connection is Mon General's Health Talk. If you'd like to be on the show, call 304-296-0041.
Dr. V.K. Raju is our guest on Health Talk today. And again, he is the founder and medical director of the Eye Foundation of America, the EFA, which is a charitable organization that provides eye care in 21 developing countries to combat avoidable childhood blindness. And we have a phone call on Health Talk here this morning, and you can chime in as well, 304-296-0041. Good morning, Charlie.
Good morning, Jim. How are you this morning?
I'm doing fine. How are you? I recognize
fine.
your voice.
Doc, he talked to you. He don't put you in the office and send you back out. He sat down and talked to you.
There's no doubt. I remember many of his talks to me.
Yeah, and I put on my cataract, and I got along just fine.
All right, so that leads us right into cataracts.
Yeah, and then he got nice office girls, too. Them office girls talk to you.
You got nice office girls over there, Dr. Raju?
Absolutely.
He would agree with that.
Thanks, Charlie, for your call this morning. Okay, define cataracts for us.
The cataract is a aging changes. It's not a growth. There is a lens in the eye. As you know, the eyeball is like a camera. Camera has a lens that focuses. The lens in the eye focuses for us. With aging, just like gray hair, the lens in the eye becomes cloudy. It becomes hazy. That's called cataract, and most of the cataract, by 60, we all have a little bit of cataract and gray hair. And as the cataract progresses, it affects your reading. Depends upon you. If you are a pilot, you may need cataract surgery much earlier. Whereas if you are not doing that kind of work and you don't drive at night and you are reading okay, reasonable, driving, cataract surgery, there's no need for surgery. So it depends upon your lifestyle.
So what causes?
Aging, and there are, in spite of all the research, and we do not know, number one is still aging, but excessive exposure to ultraviolet rays, excessive fatty diets, obesity, all cataract may be a little more, including diabetes, may be a little more common, a little earlier than others. But don't think that obesity and smoking and these lifestyles will cause cataract. Still, cataract is aging, but whenever we don't have healthy lifestyle, cataracts may be a little bit earlier than others who are very healthy.
You mentioned cataract surgery. Who's eligible for cataract surgery? And is that the treatment?
Eligible means, when it is affecting your lifestyle, you are not comfortable with the cataracts, and occasionally there may be pressure problems if they are, and the doctor may ask you to get the cataract surgery a little bit earlier than others if there is a pressure problem too, because some people, by removing the cataract a little bit early, it is better for the pressure in the eye. But not all, yeah.
Besides surgery, is there other things that can be done to treat the cataract?
Today, absolutely none. Everything you see in the newspapers sometimes when it comes and all that, there are a lot of people doing research. So maybe one day, if you can stop aging, you may stop cataract too.
Yeah, so all my girlfriends over 60 and 65 now that tell me, Kay, it's dark, I can't drive, so you will have to. That's explaining why they can't drive after dark.
Absolutely.
But I continue.
Yeah. Most important is it affecting your lifestyle, because cataract is very successful. There are varieties of lenses, and we can replace the lens. So it's all depends upon discuss with the doctor, and doctor to take a minute to discuss with your lifestyle. If you are driving every day, nighttime at 200 miles, you may need cataract surgery earlier than others.
We are talking about eye problems related to diabetes. When we come back from the break with Dr. Raju, let's talk about diabetic retinopathy.
Yeah.
We'll be back in just a moment. You're listening to Health Talk on WAJR.
This is Mon General's Health Talk, providing the information you need to take charge of your health. Call us now with your health-related questions at 304-296-0041.
What is the leading cause of irreversible blindness in industrialized nations? I bet the answer, because I have it right here in my hand, Dr. Raju.
Yeah.
Diabetic retinopathy.
Yeah.
Okay, what is that?
Again, if the diabetes is not diagnosed early and not treated, and the blood sugar goes up, and they have problems with the cholesterol, they have the problem with the blood pressure, slowly the small blood vessels in the back of the eye, that's the retina. Retina is like a film of a camera. If the film is damaged, the retina is no good, the camera is no good, the retina, the eyeball is no good. So if they leak those small blood vessels initially, they may have symptoms intermittently. It may not be suddenly they don't lose anything. During that time, if this diagnosed, a lot of those can be reversible. Today's technology, we have lasers and some medications that can be injected, which were not there 5 years ago. But without the patient taking care of themselves and other things, we still will face blindness because of the diabetes.
Well, I know that you like to take the opportunity to talk about your foundation when you can, and since we have under 2 minutes left, tell me, how is your foundation doing?
Foundation is doing fine, but more than that, the most exciting thing for me and for us is the West Virginia Institute of Public Health, which started less than 2 years ago. I think we should have had this one 25 years ago. Anyway, we have that now. With the Institute of Public Health, there are two brilliant researchers are there, one from India and one from Washington, D.C. With them, Mon General Hospital and the Eye Foundation of America and the Governor's Office, Charlene Marshall was very helpful on this. We are going to launch a program, but this program is working with others rather than reinventing the wheel. That is happening in everywhere. We are going to work with others to see what really we can do for the diabetics in West Virginia.
Dr. V.K. Raju, M.D., F.R.C.S., F.A.C.S. You have a lot of initials after your name, but you're a great friend to the community because of you go, I think, take the extra step in our diagnosis and treatment of eye problems by giving us a little bit of advice along the way.
I may be more visible, but a lot of doctors are excellent. I had some medical problems 20 years ago. What doctors in Morgantown, what they did to me early, it's wonderful. All the doctors are like, most of them are very good doctors, not just me. And above all, I want to say that
we
smoking.
are out of time.
Yeah, okay.
I am so sorry.
Yeah, that's all
that is Health Talk for today, brought to you by Mon General.